Okay, in this exercise, we're going to practice hanging an intermittent secondary medication infusion. The medication we're using today is cefazolin, which is an antibiotic. So before we get started, we want to make sure we have all the equipment that we need. We have our secondary set tubing and hanger, which come in a package, and then also the medication. In the package, you'll have the hanger and the tubing. So we're going to go ahead and pull out the tubing and set it aside for a moment while we lower our primary fluids using the full length of the hanger. So we want to be sure that we're extending the hanger as long as it will go. So now that we have our primary fluids hanging, we can go ahead and back prime our tubing. We achieve this by pulling the tubing, and all of our tubing comes with the roller clamp open, as we talked about with the primary fluids. In this instance, we want to keep that roller clamp open the whole time we're doing this. So we're going to hook up our tubing to the Y site that is on the tubing above the pump, and just back prime it slowly with our primary fluids. So once your tubing is connected, you will just go ahead and pull up on the plastic cap in order to let the fluid start flowing. We're going to watch and let our drip chamber fill up about 2/3 of the way before we kink the tubing. We're going to pinch it between our fingers and pause the pump. So again, our roller clamp is open and we want to keep it open. So now that our tubing is primed, we're going to turn our attention to our medication. And we would have already scanned the patient's armband and also scanned this medication, so we can go ahead and spike the bag. Sometimes those plugs are in there pretty tight. And again, this whole time our pump is on pause. Alrighty, so now that our medication is hanging, we can turn our attention to programming the pump. So we're going to talk to the channel that our medication is infusing through by choosing channel select. And at the bottom of the screen, we've got a soft key option that says secondary. So we're going to go ahead and select that to program our secondary. We can navigate through the Alaris drug library by using the page up or down function, which is on the lower right-hand side of the screen, or you can use the soft keys on the upper right-hand side to navigate through the alphabet that way. So if we select A through E and then C, we'll find our cefazolin medication. So we're going to select the soft key on the left-hand side. And our cefazolin comes in, we've got an order for 2 grams in 100 mLs. The Alaris drug library is automatically going to account for the additive in the medication. So it's going to be 2 grams in 110 mLs. We're going to say yes. You'll notice that Betty is just following the prompts that the screen is giving her. So once we've confirmed again that this is the correct concentration, we'll hit next to confirm. Notice that the Alaris pump automatically updates the duration of the medication based on the volume. So we're going to go ahead and confirm that and select start. And before we can turn our attention away from the pump, we want to ensure that we have our medication going by verifying 3 drips from the drip chamber on the secondary. The next step before we leave the room is to update the medication in the patient's MAR with the infused time based on what the duration in the pump was. So in the pump it said it would infuse over 33 minutes. We'll enter that into the MAR and you'll all have a chance to practice that in class today.